On today's episode, I'm talking all about coughing in older dogs. I'm answering a question about is there a link between heart failure and seizures. Next, is it okay to spay an older dog? Then, how many grapes are poisonous for a dog? And what flea treatment should you use if your vet doesn't stock the one that you would prefer? But first, let's cue the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian, Dr. Alex Avery.
Hi, and welcome to episode number 11 of the Dr. Alex Answers show. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, and my aim is to give you the information that you need to help you look after your pet to the best of your ability. Now, if we're meeting for the first time and you enjoy the show, make sure you're subscribed to the podcast. I've got loads more valuable episodes lined up that you definitely won't want to miss. Now, you can also get your question answered just by heading over to dralexanswers.com. You know, I love receiving all of your questions and I wouldn't be able to do the show without them. So, don't be shy and ask me any question you have. It could be about your pet who is ill. It could be about how to look after them and keep them healthy in the first place, or just a question about kind of why they're doing a certain thing or a certain behavior. So be sure to head over to dralexanswers.com to submit your question today. But before we get going on today's show, I just wanted to read out this review from 100 Hot, who writes, "Finally, a great resource for pet owners, or should I say pet friends or pet relatives, as I see them as true family members. Dr. Alex shows that he really knows about pet health, and he's here to help all of us who truly care and worry about our furry friends' health and well-being. Definitely a must-listen podcast." So thanks for that really kind review. Yeah, definitely. Pets are parts of the family. They're not just, kind of animals who kind of coexist with us. And, it's really important that we, kind of show them the love and respect and healthcare that they deserve for everything that they bring into our lives as well. So, yeah, thanks for those kind words. And I'd love it if you've got a couple of minutes, if you just head over to ourpetshealth.com/review and leave me your honest thoughts and opinions on the show. Reviews, especially on iTunes, they help more than you can imagine with other people finding this podcast, and I'd appreciate so much if you could spend just a minute or two leaving a review over there. Right, so let's jump into the first question, and this one was sent in by Paul, who says that he's attached a video of a friend's dog. It's got this weird bark, and he's confused by multiple diagnoses from their vet. Any idea what it is? So I'll just play a little clip from that, an audio clip from that video now, so you can kind of hear what's going on. Okay, so what did you think that sounds like? Well, to me, it sounds very much like a cough. And as far as the cough goes, it could be anything. There's no way to specifically give a diagnosis based on what a cough sounds like. But it really looks like a cough rather than a bark. And that's because the dog actually does swallow after kind of making this noise, which likely indicates that he's coughing up mucus, which is then being swallowed. And this actually just highlights the importance of a video. So always take one of your pet doing the thing that you're concerned about, because when we describe something, it's actually very, very difficult to get a true picture of that. And unfortunately, a lot of the time, our dogs and our cats, they don't perform whatever it is they're doing at home at the veterinary clinic. So having a video makes a really big difference. And in this case, it could mean the difference between actually investigating a cough or investigating something completely different, which isn't what's going on. So video is really important, and I think this highlights that really nicely. Now, it could be an infectious problem, absolutely, kind of kennel cough, a viral disease, something like that, even a kind of start of a pneumonia, depending on how well the dog is. But with an old dog, I'd also be wondering about chronic bronchitis, as well, with the possibility of a collapsing trachea, although, this latter part is not quite as common as just a chronic bronchitis. So if his breathing is noisy at other times as well, and his bark is actually kind of a little bit weird, or it sounds a bit strange, then laryngeal paralysis is a possibility as well. Now, that's normally kind of a bigger dog, but yeah, absolutely, it could be the case in a small breed dog as well. Heart failure is also a possibility. You would expect an abnormality to be heard with a stethoscope, so that's something that should be picked up in an examination with a veterinarian. But what happens here, if the heart's failing, then it can fill up with fluid. The lungs can effectively develop a little bit of fluid, which can cause coughing, but more likely you get an enlargement of some of the chambers of the heart, and that can press on some of the small airways, which triggers this coughing. So, with heart failure in small dogs, we will also often get a cough, and it can be very tricky sometimes to determine whether the heart is causing a problem or there is a problem with the lungs, because a murmur on the heart being heard on examination doesn't always necessarily mean that there's heart failure either. So that kind of needs to trigger some more investigations. So really, you can see a lot depends on the history, what else is going on at home, and examination findings. So what can we hear when we're listening to the heart and to the lungs and to the throat and the larynx, the voice box with a stethoscope, and other kind of body changes as well. So temperature, checking the abdomen, the gum color, and how quickly kind of that's changing when you put pressure on the gum. So there's a lot to kind of consider here, and really an examination is key. But an examination isn't the be all and end all, and it can't often give us a definitive diagnosis. So diagnostically, really, if things don't seem to be progressing with whatever treatments been happening, been trialed, and sometimes we will just trial a treatment, see what happens, see if it works, and then make a presumptive diagnosis. But there are other tests that can be done. So we can do blood tests, and we can actually do a specific blood test to look for markers of heart damage and heart stress, which is something called a pro-BNP test. We can also anaesthetize to actually look at the larynx, to look at the voice box, to see if there is any sign of paralysis. We can also take x-rays, and that can look at signs of heart failure, for cancer, which is a possibility, for lung disease as well. And then finally, we can also take some flushing samples from the lungs, so something called a BAL, or a bronchoalveolar lavage. And effectively what happens here is, while the patient is anaesthetized to have the x-rays and to have the other tests done, is they can have either a little endoscope, so a wee camera kind of pass down into the lungs and a sample retrieved that way, or we can pass a little catheter down the tube that's delivering the anesthetic gas, add some water, suck that back up, and send that off to the lab, which can be really useful tests to look for infections and signs of chronic bronchitis. So those are my thoughts about this case, but I think it highlights a couple of really interesting and important points, and that is that a video really does make an awful lot of difference when it comes to trying to describe and trying to find out what's going on at home, because otherwise we can be led astray and maybe kind of have tests done that are completely unnecessary, or miss things that are otherwise important. And it also highlights the importance of an examination and working through a process. So we can't always get an absolute answer. And if something isn't working, if you're trying a specific treatment or management strategy and it doesn't seem to be making any difference, then keeping in touch with your vet and letting them know, so that plans can be adjusted, more diagnostics can be taken, and the case can be worked up more fully. So kind of those are my thoughts on this wee dog that's coughing like it is.
You're listening to the Dr. Alex Answers Show.
So question number 2 is from Court Mickey, who writes that her female Chihuahua is 8.5 years old and not spayed. So she's never tried to run away. She's a house dog, but for health reasons, Court Mickey is considering getting her spayed and wondering if it's worth doing it at this age, at 8.5 years of age, or is she, just too old to spay? Is there no point? So really, if we're thinking of spaying, there are 3 big reasons and benefits for spaying a dog. The first of those is to prevent pregnancy. The second is to prevent a condition called pyometra, which is an infection of the uterus, where the uterus effectively becomes a big balloon full of pus. So it's really horrible. It's potentially life-threatening, and I'll get onto that in just a minute. And we also want to reduce the risk of mammary tumours. So that's the other big benefit of spaying. Now, at 8.5 years old, we're less likely to get pregnant. Certainly older dogs can still get pregnant. She's also a house dog, so she's probably unlikely coming into contact with entire male dogs. So that's maybe less of a risk and less of a consideration with this particular Chihuahua. There's also less benefit for a reduction in mammary tumours in older dogs. So we tend to think that if we're spaying before that first season, we get about a 99.5% reduction in the risk of mammary tumours. If we're spaying before the second season, it's about a 95% reduction. And before the third season, about a 75% reduction. Now, after that, there doesn't seem to be such a big difference. Though having said that, there does seem to be an increased survival if an animal has been spayed within 2 years of mammary masses developing. So mammary masses are really pretty common in entire animals, and about 50% of those that do occur are nasty malignant tumours. So that means they can spread to other parts of the body, and they can ultimately be fatal. Benign tumours can grow very big and can cause severe problems as well. So yeah, the 2-year survival of kind of from mammary cancer is better if a dog has been spayed within the last 2 years. So, there's still going to be a slight benefit, I think, from that point of view. Now, moving on to pyometra, so this infection of the uterus, really 1 in 4 female dogs will develop pyometra by the time they get to 10 years of age if they remain entire. Now, this condition, it does have about a 95% survival rate if it's treated appropriately, but this does require kind of expensive emergency surgery in the majority of cases. Now, some can be managed medically, but these are really the minority of cases where this is preferable. Emergency surgery is generally gives us the best outcome and is the preferred treatment. And either way, both are still kind of severe interventions, and they're expensive treatments that carry some risk as well. So those are really the benefits of spaying, and I think that kind of highlights the fact that in an older dog there still is going to be a benefit to getting them spayed at this age, and even later. Pyometra is that common, and it's much better to have an elective surgery when a pet is otherwise healthy than to wait until they're really sick. There's also going to be a big cost difference there as well, which is maybe something to consider depending on your kind of financial circumstances. Now, having said all that, there's no such thing as a no-risk procedure or no-risk surgery procedure. So the risks of spaying are that, an anaesthetic and a surgical procedure does carry some risk. That risk is going to depend to a certain extent on the health of the individual. We can do pre-anaesthetic blood testing to check that the liver, kidneys, and rest of the body function seems to be working well. We can give IV fluids, so intravenous fluids during the operation, and I think that's not an option. That's really a necessity for an older dog like this. And really, unless there's specific individual concerns because of other diseases being present, or maybe blood test results showing that there may be something else going on, the risk of surgery really is very low. And that's in a young dog and in an older dog. Now, there are also potentially some side effects to being spayed. There are some potential risks in certain breeds if spayed before 12 months of age. So that's cruciate disease, bone cancer, and numerous other ones. There doesn't seem to be any risks, or there's no known risks in spaying a female dog older than that in an older, so certainly an older dog. I don't think we need to be worrying about these things. And I've actually got a separate piece over on ourpetshealth.com that really is a comprehensive review about the risks and benefits of spaying a female dog in general. So that's more targeted at kind of younger dogs, so whether we should be spaying at 6 months, at 12 months, or maybe not considering spaying at all or until they're an awful lot older. So definitely go and check that out at ourpetshealth.com, and I'll leave a link in the show notes as well. But I guess the summary is that yes, I think it's definitely still worthwhile to get an older dog spayed. We're going to potentially avoid some really emergency conditions, and I think a lot of the potential side effects of being spayed are not going to be a risk in an older dog compared to getting a younger dog spayed. Okay, so before we jump into the next question, I just wanted to let you know that this podcast is brought to you by my free ebook, which explores the risks and benefits of raw diets compared to commercial kibble diets. So if you've ever wondered what the best thing to feed your pet is, then you really need to check this in-depth resource out by heading over to dralexanswers.com and signing up for access to the Knowledge Vault, which also includes a lot of other downloads that you're sure to find useful for looking after your dog or your cat. So head over to dralexanswers.com and sign up for the Knowledge Vault today. Right, so moving on to my next question, and that's from Lasanthe, who's been watching my videos over on YouTube on dog seizures and found them very helpful, and writes that Lasanthe's dog's been having seizures kind of almost daily. She's a mixed breed dog who's between 14 and 16 years of age and otherwise very active and happy kind of in between these seizure episodes. Blood tests and urine tests don't show anything, but she does have a very bad heart. So it's enlarged. It's got an irregular pulse. So those are some of the things that we can see in the coughing dog that kind of I've discussed in that previous question, and is actually on some treatment for heart failure. So it's possible that she's been having these episodes occasionally for 2 years, but was misdiagnosed as her losing consciousness due to heart disease. If so, has this increased severity where it's easier to identify as seizures actually an indication that the heart disease is causing the seizures, or is this a new problem? And there has been collapsing episodes before. So start off by saying that seizure activity, it typically involves a loss of consciousness along with what we call tonic-clonic muscle contraction. So that's where we have the typical seizure activity where, if their legs, their muscles, they contract and then they kind of relax, or they kind of contract alternatively. So the leg is kind of extending and then contracting, extending and contracting, and we get the tremors and the seizure activity that we would typically associate with having fits. Now, collapse due to heart failure can take place with or without loss of consciousness. So if we're not having loss of consciousness, then we're going to know that that's a collapsing episode and that's not a seizure activity. If we do get loss of consciousness, though, we don't tend to get those. We don't get that muscle activity that we do with seizures. So we often get a weakness first. They'll get wobbly on their legs and then fall to the ground. Now, if they do lose consciousness, then, like I say, they don't contract and relax their muscles, or they don't become rigid like a typical seizure. So, there is a difference between collapsing and having seizures. It's important that we appreciate that difference. And again, that kind of goes back to taking a little video of an episode while your pet is having it, so that we can be certain that we're dealing with the right thing. Because if we're actually collapsing and not having seizures, then there's a whole load of things we potentially don't need to do, especially in a dog that has already been diagnosed with heart disease. We've kind of got our diagnosis already, whereas seizures are caused by different things. So we're not going to get seizure activity due to heart disease in this dog. So causes of seizures can really be broken down into a number of different kind of groups, if you like. So toxins is one. So that's something that a dog has eaten, so a poison, slug bait, mycotoxin, so that's from kind of moldy food. There's a whole range of different things that can cause seizures. Infections, so things like meningitis or other infections can cause seizures. We can get organ disease or hormonal abnormalities that causes changes in the blood that then can trigger seizures. We can get central lesions, so that's lesions within the brain that can cause seizures. So that can be kind of brain masses, brain tumours and that kind of thing. And we can also get epilepsy. So depending on the kind of the age of the dog, the nature of the seizures and the clinical exam in between seizures depends on what's going to be more likely. Now, epilepsy isn't going to be likely in this case because that's a disease of young dogs. Typically starts between about 1 to 5 years of age. There's a little bit of variation there, but it's a disease that starts in early age. Poisons is always a potential, but that's really going to most likely cause one-off seizures. Infections, that can happen at any age. There are some that are more likely to affect different aged dogs. Organ disease, definitely something that older dogs can be affected with, but you would tend to get changes in between seizures. So you might see vomiting, diarrhea, changes in drinking and urination, that kind of thing. And then central lesions, so like brain tumours and the like. Again, we would often see other neurological changes in between kind of that seizure activity, but that can be sometimes very difficult to appreciate. So really those are the causes of seizures, and I wouldn't expect the heart failure to be related, but taking a video is going to be a good idea so that you can kind of really confirm that it is seizure activity and not just a collapse with loss of consciousness.
Get your question answered at dralexanswers.com.
Okay, so my next question was sent in by JP, who writes, "Hello, can you help? My dog ate yogurt-covered raisins, about 50 of them, and she weighs 80 pounds. I then had another question that says, my 7-month-old puppy ate 2 grapes. She's approximately 20 pounds. Will she be okay?" Well, both of these owners are right in thinking that raisins and grapes can be very poisonous to dogs. Now, we don't know exactly what it is that causes the poisoning, but what happens is the whatever it is in the raisins and grapes results in kidney damage and kidney failure, which ultimately can lead to death and can be quite efficient at killing a dog. Now, different individuals have different susceptibilities, and this is where the challenge comes in with knowing kind of how many is dangerous for an individual dog and what to do about it if they do get into a bunch of grapes or a box of raisins or baking or cakes or anything like that that's got raisins in it. So over Easter, we think of hot cross buns, have potentially got lots of raisins and can be very dangerous. So because of this, it's always best to err on the side of caution, because if we wait too long, it may be actually too late to successfully treat them and to help their kidneys once we're seeing signs of illness. So kidneys are very sensitive to different to different toxins, and they don't regenerate. So if we're getting an awful lot of damage, then potentially things will be too late, and no amount of treatment will be able to save them and to kind of reverse some of the damage that's been done. Now, I've actually just produced a calculator so that you can see the potential toxic dose for your dogs. So for an 80-pound dog, we're talking about 84 grapes is the dangerous dose. So getting into 50, is potentially safe. And I say potentially because there's also been cases where dogs have had kidney damage occur at lower than the supposed toxic dose. So like I say, I think it's always best to err on the side of caution, and in this case I would definitely recommend going and seeing your vet, having them checked over, potentially going on IV fluids and having some blood tests done to check that the kidneys are working fine, because really we don't want to mess around with this. If kidney damage has happened and we're only picking that up 2, 3, 4 days later because a dog is becoming really unwell, then the likelihood is that it's going to be too late to do anything really significant about that. The flip side is that a lot of dogs will be able to eat raisins and grapes without having any problems at all, but there's just no way of knowing. We don't have a test that we can look at that says which dog is going to be sensitive and which isn't. That would be a fantastic thing to have, but we just don't have that, certainly at present. That may be something that comes around in the future. So yeah, if you're ever concerned, go and check out that calculator. I'll leave the links in the description, but that's also available in my resource center if you sign up for the Knowledge Vault. So yeah, I'll leave the link in the show notes for that calculator. And now's a good time just to remind you that the information that I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian, and it shouldn't be taken as specific individual advice for any individual pet. If your pet is unwell, if they're injured, if they're suffering from any kind of problem, or if you're worried about anything, then talking to your vet is always going to be the best course of action. And then my final question is from Bridget, who would like to know which flea treatment to use for her dogs or for her cats, because a problem here is that the vets don't always stock the ones that you want to use, but promote ones that they get a discount on, like Advocate. So what are your thoughts on this subject? Well, I'll start off by saying what we want our ideal flea treatment to do. We want it to kill fleas. We want it to persist for a known period of time. So to keep working as well as it did on day one for a known period of time. We want it to be non-toxic, easy to administer. We also want any flea treatment to cover any other parasites that may be present and may be a risk to your dog or your cat. And that's really going to depend on the geographical area that you live in, so where you live in the world, because there's going to be different parasite problems. And we also want to ideally to help reduce the environmental flea population, so that's reducing the eggs and larvae developing then into adults. So if we think about older products, kind of ones that have been around for a long period of time, and a lot of kind of pet shop and supermarket products are going to include these, not all of them by any stretch, but some of them, they either don't persist for the whole month or whatever the duration is said to be. So they might kill the fleas on day one, kind of when they're applied, and maybe have an action for the next few days, but actually they're not going to keep killing those fleas for that whole month. They might have a low safety index as well. Overdosing is easy, and actually in some cases the normal dose that we give is really verging on the toxic dose, and the interval that's given, so that month interval, is because if we apply it any more frequently to do a better job, we're actually going to really be getting into toxic levels. Some will have no action on the environment, so they won't help prevent the eggs and larvae from developing, and some are just really not very good at killing fleas. Maybe they were at one point, but their fleas are actually developing resistance to that. Now, if we move on to side effects and kind of safety, now all products which work will have a risk of side effects. So there's no getting away from that. Those risks are really, really low, and I can't stress that enough. And I've actually spoken before about Bravecto, NexGard and Simparica safety, because there was an FDA kind of reminder about the potential for neurological signs. So check that out in the previous episode. And also I've spoken about Revolution and allergic reactions to topical products as well. So, there are potential side effects. And then another side effect to know about is that really we should only apply cat products to cats. So never apply a dog product to your cat unless you've been specifically advised that that's okay by your vet, because some dog products are really very dangerous if given to cats. Now, there are so many products out there that do a very good job. I'm not going to give particular names because the names do change depending on which region you're in. And, there's a lot of different ones that cover a whole range of different parasites that, again, change depending on where you are in the world. Now, like I said, we really want to make a decision based on local parasite risk and how well each product meets the requirements of the ideal flea treatment that I've just discussed. We also want to try and avoid doubling up of products with the same action. So, it might be that you're worming your pet with a certain thing and you only need to treat fleas. So you then don't need a flea product that also does worms if you're giving a separate tablet. In part, kind of the decision to stock different products by a vet is going to be based on, what's safe, what meets all those ideal requirements, what is appropriate for the local parasite risk. But, it's also a business decision as well, because ultimately, vet surgeries need to make money to stay open, and so that's a reality. Now, if you're part of a big group of practices or a kind of a corporate group, you might be instructed to preferentially stock certain products. If your veterinarian is an independent veterinarian, they might be part of a buying group just to try and help reduce prices to remain competitive with their neighbouring practices, and they may get preferential terms on specific products. Now, the decision that's made with which one to buy is not going to be compromised by which product works. Well, you're not going to get a product that doesn't work being stocked by your vet, because ultimately that's going to really undermine their credibility and they're going to lose clients as a result of that. We're not in the business of selling things that don't work and are no benefit or are really dangerous. But, there is also a business risk there. There's just no way that a vet can stock everything on the shelf. So, the other thing to say is if you did have a specific product that you really wanted to try, then the vast majority of vets are going to be able to order something in for you specifically. That's generally not a problem. It might take a day or two or even a week to get that product in for you. But when when you're getting a box of 4 or a box of 3 treatments that's going to last a month or a month for each treatment, it's not something that needs to be ordered in as an emergency. You just need to, ring them up a couple of weeks before, you need to have a new supply and get that ordered in for you. So, that's really my thoughts around that. There are a lot of products out there, like I say, and which one is going to be most appropriate for you depends on your pet, depends on their lifestyle, and depends where you live in the world. So really just have a chat with your vet and also kind of ask them to explain why they're recommending a certain product. It may be that actually that has additional benefits to the product that you're thinking of. So, have that conversation as well. And it's not just your vet that you can speak to. You can speak to the nursing team or the reception team as well, because they often have very good training about parasite risks and which products work and which products are recommended. And that's it for this episode of the podcast. I hope you found that useful. I hope you found it interesting. And make sure that you're subscribed if you did. And if you do have a couple of spare minutes, I'd love it if you could leave me a review over on iTunes or over at ourpetshealth.com/review, just to help more people discover this podcast and allow me to help more pets, which is really what this is all about. Remember too to head over to dralexanswers.com, where you'll find the links and downloads mentioned in today's show. And until next time, take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.